called the humerus here. We're going to be taking a look at some of the arm bones, and this is the first one to take a look at. This is the humerus. I think obviously with any bone here, I've got a ulna, for instance, here. You should obviously be able to know what bone they are, and I think distinctive of the humerus is that you have this rounded head of the humerus, and you can kind of tell that it's part of a ball and socket joint. It meets with the glenoid fossity, the glenoid cavity, and the only other bone that's like that is the femur. That has a rounded head as well, but I think you'll be able to tell a femur from a humerus pretty easily. So let's take a look at some of the features of the humerus now that we kind of know what it is. And we'll take a look at this head of the humerus. And so there's that rounded edge that meets with the glenoid cavity. And then here you can kind of see that there are these really obvious bumpy features that are just opposite of the head of the humerus. And maybe not surprisingly, these are tubercles or tuberosities, bumps along the bone. We ran across that with the rib. And so you can see that there's this one and there's this one. One is bigger and one is smaller. So they get names like greater tuberosity and lesser tuberosity. So that's nice. And then there's something called the intertubercular groove. Where do you think that is? Here. The reason why the greater tuberosity is greater is that there are more muscles that are inserting on this. The infraspinatus and the supraspinatus and something called the teres minor, they all attach onto here. And it's the subscapularis that inserts here. And so that's kind of the job of those tuberosities. Let's take a look a little further down. Just lower than the head here, there's something called the neck. And they have two names for the neck of the humerus. There's what's called the anatomical neck, which is kind of just around the edge of where the head is. And then there's this region. And so all around here, this is what's called the surgical neck of the humerus. And it gets called that because there tends to be surgery here. If someone has a broken humerus, it tends to be in this area. Not always, obviously. You can break your bones in all different kinds of ways, but there does tend to be often surgeries here. So they call it the surgical neck. And then let's go down a little further. You can see this kind of rough part on the bone here. It's kind of raised up. There's a muscle that attaches there. It helps shape the bone. This is another tuberosity. It's called the deltoid tuberosity. And so you have the deltoid muscles that attach in there. All right, we'll go further down. And then you can kind of imagine that there's going to be some anatomical features that are where the humerus articulates with the ulna. I have an ulna here, and we'll be taking a look at the ulna separately, but you can kind of see that there's this cup-like portion of the ulna. And one thing I will say is that this portion of the ulna is called the ulcranon process. And then this one is called the coronoid process. I know we've already had a coronoid process on the mandible, but it's in reference to this kind of triangular shape. But you see that kind of pokes out, and then that pokes out that way. You got this ulcrinum, coronoid. All right, that's going to make that's going to be relevant here. So I guess one thing I should point out is, well, what's the front and what's the back of the humerus? So this is the back, and that's because it's the ulcrinum process, that larger portion, it's kind of big knobby end of the ulna, that wraps around the humerus like that. And so you have articulation between the humerus and the ulna like this. And because of these things that wrap around the humerus, the places on the bone where they glide get names. So this is called the ulcrinum fossa, a ditchy part in bone, and this is called the coronoid fossa. You can also see that there are these parts of the bone that stick out to the sides here, and these are called epicondyles. So they get that name because they're kind of on top of the condyle. The condyle is very smooth, and then these are epi on top. And again, I think a clue here is to take a look at the head. We know that that's going to be articulating with the scapula. We know that this is then going to be medial, and this is lateral. And so then we take a look here. This is the medial epicondyle. It sticks out more and is a bit prominent. This is the lateral epicondyle. The medial epicondyle is something that if you ever bump it, it does kind of stick out. You can feel it. Well, you can feel both of these, but this medial epicondyle particularly sticks out, and if you bump it, there's a nerve that travels along in this groove, and when you strike that, it causes pain to kind of shoot down your arm, and they call it hitting your funny bone. So if you wanted to find exactly where your funny bone is, yeah, it's right there.